What is oxygen therapy for child bronchiolitis? Imagine a tiny child struggling to breathe because their lungs are inflamed and filled with mucus. That's what happens during bronchiolitis, a common illness in infants and young children caused by a viral infection. When the small airways in the lungs become swollen and blocked, it can make it hard for oxygen to get into the blood. That's where oxygen therapy comes in. It is a medical treatment used to help children breathe better and keep their oxygen levels safe. The main goal is to make sure enough oxygen reaches the blood so the child's organs can work properly and to prevent serious complications. Oxygen therapy is usually started when a child's oxygen saturation drops below 90%. Oxygen saturation is a measure of how much oxygen the blood is carrying compared to its maximum capacity. If the child shows signs of difficulty breathing, such as rapid breathing, nasal flaring, or poor feeding, doctors may decide to begin oxygen therapy even if the saturation is close to 90%. The treatment can be given in different ways, depending on how severe the child's condition is. For mild cases, a simple nasal cannula, which is a small tube placed in the nose, can deliver low-flow oxygen. This helps gently increase oxygen levels without being invasive. For children with more serious symptoms, high-flow nasal cannula therapy is often used. This method delivers heated, humidified oxygen at higher flow rates through special nasal prongs. It can also provide some positive pressure that helps keep the airways open, making it easier for the child to breathe. This approach can significantly improve oxygen levels and reduce the effort needed to breathe. It is often preferred in moderate to severe cases of bronchiolitis. It's important to note that just holding oxygen near the face, known as blow by oxygen, is not reliable enough for children with significant hypoxia. The target oxygen saturation level for children receiving therapy is generally between 90 and 97%. Maintaining levels above 90% is considered safe and helps prevent tissue damage. However, too much oxygen can also be harmful, so healthcare providers carefully monitor the child's oxygen levels and adjust the flow accordingly. Once the child's oxygen saturation remains above 90% without signs of distress, the oxygen can be gradually reduced and eventually stopped. Oxygen therapy is part of supportive care for bronchiolitis. Along with oxygen, children often need help staying hydrated and clearing their nasal passages. Other treatments like bronchodilators or steroids are not routinely recommended unless there are specific reasons. It's essential to remember that oxygen therapy should always be administered under medical supervision. Overuse or excessive oxygen can lead to lung problems or oxygen toxicity, so healthcare providers carefully choose the right method and settings. In summary, oxygen therapy for child bronchiolitis is a vital treatment that helps ensure enough oxygen reaches the blood when the lungs are inflamed and blocked. It involves delivering oxygen through nasal tubes, often high-flow in more serious cases, to keep oxygen levels safe and reduce the child's breathing effort. This approach is supported by pediatric guidelines and is a key part of hospital care for infants with moderate to severe bronchiolitis. Always consult healthcare professionals for personalized advice and treatment options.